A coalition of health civil society groups is marching against the Gauteng Department of Health. The group is made up of lobby groups Section 27, Cancer Alliance and Treatment Action Campaign. The march is to demand that the provincial health department spends the 784 million rand that was set aside by the Gauteng Treasury in March 2023 to outsource radiation oncology services. These organizations say there are about 3,000 patients on the backlog list waiting for cancer treatment, while the government has failed to spend the funds. SABC News reporter Calvin Dludla has more.
We are here at the Library Gardens today because cancer survivors are marching to the Department of Health. They have several complaints against the department. I'm not alone. I'm with Salome Meyer. Salome, thank you very much for your time. I understand you are coming from a cancer organization. Why are we here?
So more than 3,000 patients have been waiting patiently for the radiation oncology in Gauteng. A year ago, the Treasury actually allocated 784 million rand for the outsourcing of radiation oncology. And to date, not 1 cent has been spent. The tenders have been advertised, but nobody has been appointed. Not one cancer patient has been called for their radiation oncology services. Patients are waiting patiently to be treated, and many patients are actually either being diagnosed with recurrence or cancer that is spreading, and actually some patients are even dying.
What major impact does it have?
It has a major impact on a cancer person's life. If you know that you need to have radiation oncology, however, the system doesn't want to provide it to you. It is a basic human right that is being violated, especially in the light of the fact that money has been allocated. This is inaction in our largest form in this country.
I hear that you will be marching to the Department of Health today. What are you going to say to them?
We are going to say to the department, start acting and start doing what you are supposed to be doing. You have to communicate to patients what is happening. There is a backlog list, and you cannot come and tell us that you are actually attending to the problem that is going to happen in the future. We have got patients that have been there for years, and they deserve an answer from you.
Have you been communicated with them before? What are they saying, if you have been in touch with them about this issue?
So we have been in touch with them. We in fact had a cancer crisis task team together with them, and that is how the money was allocated, through the work of the cancer task team, working also with Treasury. But the Gauteng Health Department has suspended all communication with Cancer Alliance as well as Section 27.
Thank you very much for your time.
Thank you kindly for having us.
Thank you. That was Salome Meyer, one of the survivors of cancer. He was telling the SABC that they have been trying by all means to communicate with the Department of Health, but to no avail. She is telling us that they will march to the Department of Health offices today to hand over their memorandum.